So as a quick recap, when we think about syndromes of orthostatic intolerance, right? Symptoms that come along when we stand up. This is really a story about the ability to produce energy and to create activity in neurons within the brain, right? So if we backtrack that back out, we know that to create energy in the brain, to be able to make it work, we've got to have oxygen. If we want to deliver oxygen, we've got to have adequate blood flow. We've got really good at measuring changes in heart rate. We know that if the heart rate goes up, that's not good, but it doesn't tell us the whole story about what's going on. A lot of times when the heart rate goes up, it can also be just because systemic blood pressure, mean arterial pressure, is going down. And the fastest way that we can compensate for that is by elevating the heart rate. In addition to that, we also have this mean arterial pressure that is in the body, but that has to get transferred into the brain. So we can see in some cases where arterial pressure may be normalized, but because we have different mechanisms that control blood flow within the brain, or the cerebral perfusion pressure, that we can actually see blood pressure dropping or cerebral perfusion pressure changes in the brain with orthostasis. This is very common when we look at things like POTS, we look at things like orthostatic hypotension, we look at cerebral hypoperfusion, myalgia encephalitis, chronic fatigue syndrome, on and on and on we go. Again, it's an energy problem within the brain. Can I generate enough energy to do the tasks within my brain? The last piece of that we want to look at is also relative to a concept called vasoreactivity, where not only do we have to get the blood physically into the brain, but the contents of that blood matter. So how much of it is oxygen? How much of it is carbon dioxide? How well are hemoglobin able to bind carbon dioxide and oxygen, and how well are they able to be then pushed into the tissue to be used by a cell to generate energy. So one of the things that we have to pay attention to is the amount of carbon dioxide in our blood. Normally we don't think about that. We like to think about oxygen because that's what keeps us going. But carbon dioxide actually is the signaling molecule that helps our blood vessels have reflexes to understand how big or small the vessel should be. So if we actually see low levels of carbon dioxide, it indicates there's a change in metabolism in that area of the brain, and we actually cause vasoconstriction in that area. So we decrease the blood flow even though there's low levels of CO2. The number one thing that can cause this is changes in our ventilation pattern. It's not the only thing that causes it. We'll talk about that more later. But one of the main things is how we breathe. So hyperventilating, breathing too much, too fast, or too big can cause changes in CO2 ratios in the blood, or hypocapnia. And one of the ways that you can check for this, we like to do it in the office. We use capnography, where we can measure it using a machine that tells us how much CO2 is in the air we breathe out. We can also look at a very quick rudimentary test, thinking about what is our tolerance to CO2. So you just take a big breath, hold, and put it on a timer, and you want to see how long you're able to hold your breath. In the study we look at, people should be able to hold their breath for at least 45 seconds comfortably. What you'll notice is people that hyperventilate have a hard time doing this. So for you, you may want to just look and see within that 45 seconds, how long can I hold it? And if it's not that long, then we may think about, number one, are we breathing too much? It's called hyperventilation or tachypnea. I'm breathing too much, blows too much carbon dioxide out, changes that relationship in the blood. Number two is we call it hyperpnea. And hyperpnea is a little different because it's actually when we breathe too deeply. A lot of times we like to meditate. Deep breathing is a way typically to calm people down. But in some cases, you might notice you feel a little lightheaded or a little off when you do deep breathing. These are cases where using those big tidal volume breaths cause us to also blow off more carbon dioxide. So typical breathing should just be kind of slow, not too deep, right in the middle, a little bit of Goldilocks type breathing. So use that 45-second test. See if that's something that you're noticing. Is that a definitive test for hypocapnia? No. But it can be an indicator to see if you're using oxygen and carbon dioxide effectively. Hope it helps.